Good evening, everyone. Welcome to our fifth Academy of Osseointegration podcast, where we have probed into the minds of remarkable and influential individuals shaping our profession today. In this episode, we have a distinguished guest joining us, Dr. William Giannobile, the Dean of the Harvard School of Dental Medicine. My co-host is my friend, Dr. Lorenzo Tavelli, PG Director of Periodontology at Harvard. Will brings a wealth of knowledge, insight, foresight, along with wisdom and innovative thinking, making significant contributions to our fields of dentistry and academia for the benefit of our patients. Together, Lorenzo and I will be exploring his journey, his diverse personal story, and the future of dental education and healthcare. Our conversation promises to inspire as well as to educate. Our focus tonight will be three parts: leadership and education, regenerative medicine, and artificial intelligence and personalized periodontal medicine. Lastly, Will, Lorenzo, and I will recommend books that can be read, or better yet, listened to on tapes as we drive, that will also energize and encourage you to learn and read or listen more about each aspect of this podcast. And that'll be our last slide. So let's begin. Good evening, Will. Good evening, Lorenzo. How you guys doing? Well, please share with our audience your personal story of how you were brought up in rural central Missouri, eventually settling at University of Michigan, and finally relocating to Boston as Dean of Harvard.
Well, thank you so much, Bob. I really appreciate this opportunity to be with you all this evening. Appreciate the support of the Academy of Osseointegration, and a really exciting concept of this hot seat podcast. And so it's really my pleasure to be with you this evening, and also with my good colleague and friend, Lorenzo Tavelli. And so, to kick things off, I think each one of us has our own personal journey that has gotten us to the place where we are. And so as you give that background, I was born in Chicago. And when I was a young person, my father decided to uproot the family from Chicago and say, you know what, let's move out to farm country out in Missouri. And he picked up the family. There were 4 kids. I was the oldest of 4. I had 3 sisters. And he moved to the rural farmlands of Missouri. He didn't have a job. He just said, I'll find work and we'll make it happen. And so we landed at a small farm in south central Missouri in the forest city of the Ozarks. And there we grew up on a small farm, dairy farm. And it was also in a winemaking community of German and Italian Americans in this small town called St. James, Missouri. And so it was there that we grew up on this small dairy farm. And then for 6 years, I also did work at a vineyards and winery there. And many people laugh when you think about the winemaking region of Missouri, but it was actually quite good. And so it was there that I, had the opportunity to, work in the farmland area. But then at an early age, I got very involved in science and participated in school science fairs, and then ended up going to state science fairs and then international science and engineering fairs, where I got that interest in science. And then one of the local dentists in the area, he had a small farm. His name was Stephen Atkinson. And I would help him with his dairy farm. And I always had this interest in science and possibly medicine. And it was there through some of his inspiration that I developed this interest in dentistry. And so went to college at the local University of Missouri, Rolla, which was mainly an engineering school. And then moved on to the University of Missouri, where I earned my dental degree, Master of Science in Oral Biology, and then moved to the Harvard School of Dental Medicine, where I was fortunate to receive a funding support through the National Institutes of Health in a program called the Dentist Scientist Program, where I was able to earn a periodontology certificate and then a combined degree Doctor of Medical Sciences in oral biology. And I stayed at Harvard for 2 years, postdoc and faculty, and then moved to University of Michigan, and was at Michigan for 22 years as from an assistant professor to a professor and chair, and then came back to the Harvard School of Dental Medicine in 2020 as dean. So that's trying to abbreviate that odyssey in how I've ended up to where I am today.
Great. Thank you for sharing. Let's talk a little bit about leadership, Will. What values do you believe are crucial for effective leadership in academia and the medical dental field? And second part is, how does one acquire these leadership skills? And how does teamwork factor into your success story? So two-part question.
Okay. Yeah, Bob. Yeah, a lot of good components as we look at leadership. And I know we'll see at the end of this podcast some really good recommended reading. And I have to say that I feel like I've been blessed over the years to have the opportunity to work with so many great leaders from being a young person and as I've grown up and developed my own career in academia. I think in terms of developing leadership skills and understanding how to develop and form a team, having a positive leadership mindset, I think, is critically important. And so to build teams, it's really to recognize the strengths of all of the team members and helping people work to their strengths, because we all have our shortcomings, we all have our limitations. And, within a team and being a leader, it's inspiring others to support them and to help them believe in themselves. And I went through, actually, it was I think back many years ago, a positive leadership course. And I worked with some of the kind of the founders of the positive leadership training programs at the University of Michigan. And so some of the key points is really looking at how can you imbue others to have them help believe in themselves. And one of our exercises was, okay, what is your life's purpose? And how does that transcend to all aspects of your life? And what I developed as my own life's purpose that relates to leadership is to inspire others to be the best that they can be, and then to help propel new knowledge generation forward. So it really has the two facets of leadership and then my own passion as it relates to science. And so that's been something that I've focused on. And, as a young person, that, building confidence in your team, I think is very important. And, one other key element is within leadership and within your team is developing that psychological safety and feeling where the members of the team can speak up, provide their criticisms and critiques, because we need to listen to all of the voices. And so as a leader, being able to create an environment where people can openly provide that feedback and help to make the organization better. It doesn't matter at what level of the organization someone's in, to provide that feedback. And those members of the team feel an ownership in the organization.
Yeah, being in private practice for over 35 years, there's no question leadership is a big part of being successful. So thank you. Regarding you coming into Harvard, September 1, 2020, the height of COVID, I mean, you couldn't have picked a more wonderful time to start a position as a dean. So this is probably the most disruptive time in world history as we could think about it. So what is your vision for Harvard over the next 3 years? And I'm sure that was kind of disrupted by COVID when you started.
Right. Yeah. So Bob, we all suffered through the pandemic, right? So I think everyone can look at their own personal challenges that they've had in their career, being involved in clinical practice, the tremendous disruptions that everyone had in the delivery of clinical care and functioning. And so, when you look at timing, so much in life is based off of timing. And, I signed my agreement to become dean on March the 23rd of 2020. So the pandemic was building, and I just thought, okay, this might be a couple of months, and I'm going to start in September. Hopefully things will blow over and it'll be fine. But what I will say that every dental school faced it, Harvard, you name it. But when I started in September 2020, the clinics have been nearly completely closed for 3 months, only providing emergency care, and then really how to, open the clinics, provide a safe environment for students, and creating that. So, to bring people together, and you were asking about leadership and to affecting a vision, you really have to bond with the leadership team. And so we had to do so much remotely. And it was a year and 9 days after I started before I could have the whole leadership team in one room together. Yeah. And so a lot of the ideas that I had, with a focus on research and discovery, in really advancing clinical translational research, I really had to step back and think about, at a dental school, the priority is the students, helping them succeed and getting their clinical training. And so we really focused on our clinical activities, creating a safe environment. And then, like all dental schools, all clinical practices, gradually, we recognize dentistry is a very safe profession. And, we were able to, then it was just that little hiccup to get started. But
it's really amazing how safe our profession is when we look back at it, and how scared we were that it wasn't, and our patients still came. So that was something we really learned. Can you share a defining leadership moment or experience that has shaped your positive leadership style that you exemplify, Will?
That's a good question. There's so many different times in my career, in terms of where I've been inspired by others who I work with in terms of their own leadership style and seeing, their successes. I think, in terms of moments where I feel most rewarded about my own leadership is when, I have worked to enable others to be in other leadership positions within the organization, empowering them and letting them have that success and show the success, and being able to be empowered to be able to execute on the vision. And so for me, seeing our young graduates go on to, leadership positions within dentistry, professional community, academia, those are some of the sweet moments to see the success where your students are going to, far exceed what you've been able to do in your own career.
True. Can you mention some mentors along the way that you have now become mentoring as they have in the past?
Yeah, Bob, I'm glad you asked that, because actually, so this past weekend I was in Bonn, Germany. It was the 100-year anniversary of the German Society of Periodontology. And the organizers, Soren Jepsen, they decided to have they decided to have a special session in collaboration with the German Academy of Sciences. And they asked a group of individuals they brought from around the globe. So it was myself, Maurizio Tonetti, Klaus Lang, Mariano Sanz, Ian Chappell, many people within periodontology. And they asked us to give a presentation on, a disruptive area in dentistry, and then spend the first half of their presentation on how they got to where they are. And you asked me earlier, how did you get to this position? But it was to highlight our mentors and highlight those that have inspired us and helped us believe in ourselves. And so I had a couple of slides with this litany of mentors. It's not just one person, but certainly from my high school chemistry teacher to the person who inspired me to go into dentistry. But in periodontology, there are a couple that were really key to my development. Ray Williams, who was he was a person that came up to a poster of mine at an AADR meeting, and he knew I was going to be applying to the Harvard School of Dental Medicine. He came up to my poster, he said, "This is, some good work." And then he sent me a letter and he said, "You're accepted into the Harvard School of Dental Medicine, without doing," he said, "that was your interview." And then I later joined. So he was someone that I always think about. Myron Nevins was one of our faculty at HSDM as well, really supporting me. And then as I started to enter into my journey as an editor, Journal of Dental Research, Journal of Periodontology, Bob Janko, Ken Kornman, Klaus Lang, other mentors. So there's many different people who inspired me and gave me these opportunities.
Yeah, great. Let's go into history now. Relating to two of my favorite people in history, Abraham Lincoln and Martin Luther King. Both are amongst the most influential leaders in American history. One at the time of the Civil War and one about 100 years later with the Civil Rights Movement. So what challenges did you face along the way? As life is never linear. We know that in baseball, we know it in all sports, as well as in academia. And this is a quote by David Brooks. "Great leaders often experience crushing personalized setbacks." So what made you stronger and to keep going on, Will?
Yeah, I think that, leadership is very challenging, and you will have those moments where you will feel quite isolated and, just approaching total failure, especially when you're involved in new endeavors. And it's one of the things that, I always encourage others to take risks. Sometimes things will work out and sometimes they will not. And as I think about some of my early opportunities at leadership, one of the first big opportunities I was given was when I was at University of Michigan. There was the dean at the time, Peter Polverini. He contacted me and he knew that there was an interest to embark on promoting clinical research at the school. And I remember that, there was no clinical space for clinical research. I was a fairly early stage career, an early career stage as a junior faculty member. And he gave me this big opportunity to say, "Okay, we'll try to develop this clinical research center." And so we found a location outside of the dental school, combined with the School of Medicine to really have this collaborative center with the medical school. And, oftentimes when you get involved in new initiatives, you'll have many people who will embrace the change, embrace the new opportunity, and then others who will resist and they want to promote the status quo. And so I remember when I started in that role and we opened up the Clinical Research Center, it was like crickets. Many people said, "We don't need this center. We don't need you. We will do it our way." And then I was really trying to, demonstrate the value, demonstrate how this was going to help the school, help the clinical researchers. And so it took me many years before I could really demonstrate that value to the other members of the community. And then it eventually led to some successful studies, that were done in collaboration, with FDA and other stakeholders. But those first years were very difficult, and really questioning whether I was on the right path or not. And it's having that persistence and the grit we oftentimes hear about, to not give up, because oftentimes you feel quite isolated, and it's like, okay, did I make the right decision?
So in other words, you didn't get a trophy for everything you did, Will, right? All right, let's move on. Lorenzo, please take over for regenerative medicine. Thank you.
Yes, thank you, Bob. Thank you, Dr. Giannobile. I think so far we have had an amazing discussion on leadership. We want to dive a little bit more in the field of regenerative medicine that we know is one of your expertise. And in particular, I would like to ask you, what is your plan or vision as Dean of the Harvard School of Dental Medicine for the future regarding regenerative medicine, use of gene therapy, growth factors, scaffolds, and biologics?
Yeah, so Lorenzo, great question. And, I've appreciated, we've had our own opportunities. And when Bob was asking about, what are some of the greatest joys, is when you see some of your former students really excelling and exceeding what you've been able to do. And so you're an example of someone who's really embarked on regenerative medicine as well, from a clinical arena. So it's been great to be able to collaborate with you. I think that you're aware, and I think for those, the listeners who are tuning in today, this whole field within dentistry, I'll talk more generally about the future of regenerative medicine and dentistry. And one such example is, I've really appreciated that at the national level, through the National Institutes of Health, looking at the strategic plan nationally on how can we enable the development of new tissue engineering technologies. And much of this, we've had the great opportunity to be supported for nearly 10 years by the NIH to have a resource center in regenerative medicine through Michigan, the University of Pittsburgh, the Wyss and the Wyss Institute at Harvard. And then there's a whole consortium in California of many of the University of California schools. And what has centered around that, to your point, Lorenzo, is that there have been many developments in regenerative medicine and dentistry in the whole area of stem cell biology, those stem cells that might be able to eventually create teeth. To those stem cells are formerly called mesenchymal stem cells that can be used to form a variety of different tissues, from soft tissues, connective tissues, to bone, cementum, and looking at how can we program cellular therapies to reconstitute tissues. The other big area is in the area of biologics, from polypeptide growth factors to different biologic agents that can improve and increase bone density, bone mass, to those types of biologics that have an anti-inflammatory or inflammation resolution capacity. And then looking at advancements in areas that you're very involved with as well, on microsurgical techniques, the use of minimally invasive surgical approaches that oftentimes are coupled with many of these new technologies. And then we're all very well aware of how different scaffolding technologies, such as bioresorbable scaffolds, some are polymeric, some are calcium phosphate, bone-like scaffolding matrices that can be digitally designed to be personalized for the various architectures of different craniofacial defects, to something as small as a periodontal defect. So those are a couple of the big bucket areas of regenerative medicine. And I think, as you know, to develop these new technologies, to get them through the pipeline in the whole regulatory process for the FDA, or in Europe, the European Medicines Agency, that takes, I mentioned grit before, to get something into the clinic and then have it be clinically adopted is another thing for clinicians to be using it every day.
Yes, and you already mentioned some of your mentors overall, like in terms of leadership and career. But if we think about this specific topic, could you please tell us who were actually the mentors that inspire you and giving you a push towards investigating at the early time of your career all of these biologics, scaffolds, and therapies in the field of regenerative medicine?
Yeah, so absolutely. Sam Lynch was a very important mentor. He was my Doctor of Medical Sciences thesis advisor. He's a true innovator in terms of using the first recombinantly derived growth factor in periodontology, platelet-derived growth factor. And so as a young person working in his lab, had the opportunity to see how these growth factors could be used in soft tissue wound healing to heal neuropathic diabetic ulcers. And he had the vision to apply these to periodontal defects, later peri-implant defects. And so that was my foray into, when I was a graduate student, I worked both as a student in the program at the Harvard School of Dental Medicine, but also a spinoff from Harvard was the company that was initially called PDGF Incorporated, and then it eventually became the Institute for Molecular Biology, and then it went through several other iterations into biomimetic therapeutics and eventually Lynch Biologics. So to see those many different iterations and to learn from a mentor who had a real tenacity to help make sure that this technology to not give up on its potential. So he certainly was a key mentor in that domain. As a master clinician, someone very involved in the clinical application was Myron Nevins. And really, that was a great partnership as a young person. And then later, when I moved to the University of Michigan, it was Martha Summerman, who was the chair of periodontics, eventually became periodontics and oral medicine. She also was a leader in regenerative periodontology, but more from the basic biology. And so for me, I think what helped me to become, I consider myself more of a translational researcher, not a very strict basic scientist, not just a strict clinical researcher, but more in between, bridging the basic to the clinical. And of course, I've been involved in dozens of clinical studies, but it's just that junction between the two that, I felt fortunate I had those mentors.
Great, and this brings me to another question. What are your thoughts, and are you surprised that we are not really have gone further in our surgical specialties using regenerative medicine? For example, thinking about the landmark multicenter clinical trials that was published in 2005, Journal Periodontology, on the use of PDGF for infrabony defects. So are you surprised that after that we really haven't gone too much further in the application of these biologics?
Yeah, it's a good question. I wish I had a better answer for it than this, but I think, and Bob was asking me earlier, as you think about discovery research and bringing that into the clinic, there are many different technologies that we've seen that have gone from the bench to clinical studies, but then to take the next leap to have it be clinically adopted widely. We're still at a point with many of these regenerative technologies that there's nothing magical about growth factors or very specific biomimetic scaffolds or stem cells without currently, when you're delivering something to a periodontal defect or a peri-implant defect, you have to have outstanding surgical exposure and wound stability. All of the basic principles of wound healing have to go hand in hand with any type of regenerative approach. And so, this really gets to an area I know, Lorenzo, you and I are very keen on is periodontal regeneration, tooth preservation. Many people think it's much easier just to give up on trying periodontal regeneration because it's technique sensitive, right? And so I think it's not only the limitation of the growth factor, but it's, the whole protocol on combining the regenerative therapy with good surgical, exposure and implantation of the device. Plus, in periodontology, you're looking at an infected tooth root surface, and to get a biologically compatible surface to promote regeneration, it takes a lot from the technical skills standpoint. So, and it's something that you know very well in terms of how you approach surgery, that it won't work even with the best of growth factors, the BMPs, PDGF enamel matrix derivative, fibroblast growth factor, you name it, right? It ends up being a limitation. So it's frustrating to see that many of them have not gone further. And, and there's also the economic argument, what is the, many dentists really have to weigh out, is this additional expense going to benefit the patients? And that, many different developers haven't developed that cost-effective analysis piece.
Yes, and thank you for your answer. You really brought very interesting points. You also mentioning about all the techniques and all our efforts for striving to save teeth. So I would like to ask you if you can please share your thoughts on the, we can say, epidemic of all-on-4 therapies and treatment planning skills of clinicians that unfortunately very often do not really plan to treat, maintain, and save more teeth, especially considering that we're seeing also peri-implant diseases very, very commonly.
Yeah, so I love that question. That as we look at, we're on a hot seat podcast for implant dentistry. And I think that we recognize that one of the greatest revolutions in dentistry, especially over the last several decades, is implant therapy and how we can reconstruct patients who have missing teeth due to disease, traumatic injury, or congenitally missing teeth. And so I'm a big proponent for the use of implants. Now, to your point about preserving the dentition, as dentists, we're healthcare providers. One of our major goals of therapy is to preserve the dentition. There's nothing better than having teeth, your own natural teeth, versus an implant. A tooth is, always better than an implant when in a healthy condition. And so how can you promote that health of the tooth? And so, my concern is we look at patients who oftentimes have spent decades of neglect of their teeth and their dentition, and they will enter into a clinic and they get a treatment plan to say, let's remove all of your teeth, we'll get rid of these problematic teeth, and then deliver implant therapy, and then you can get a nice, shiny new dentition and implants and have a total reconstruction. And these can work very well, especially with skilled clinicians placing the implants and having a good reconstruction. But so much is based on, the education of the patient. And I think, as we all recognize, if they still maintain those same oral hygiene procedures for those implants that they did for their teeth, and that's what many patients erroneously think, they will be headed for big problems down the road. And so there's so much on the education side, but I would also say on the education side of identifying who are good implant patients, the same risk factors for tooth loss are the same risk factors for implant loss. And we really need to carefully look at that. And I think what's happened is the criteria that have been put in place on whether or not to save a tooth based on endodontic problems or periodontal problems, both perio and endo, the fields have advanced greatly over the years. And teeth, we can do more things to preserve teeth today than we did 20, 30 plus years ago. But there are some practice settings where the decisions being made to keep a tooth are such that teeth are being removed with fairly minor issues. And that is unfortunate. And then implants are placed potentially in positions that are not ideal, and oftentimes by those clinicians that don't have the extensive training in implant therapy. And that's where I think we've all seen, you and, all of us as periodontists, we didn't go into perio to treat peri-implantitis. We don't want to be the dumping ground to try to manage those problems. And, there's a responsibility to those clinicians placing an implant in a proper position, having a good volume of bone around the implant, cleansable, good soft supporting soft tissues, cleansable, and a good maintenance program.
Before we go to the next section, I want to add my number one mentor of the last 15 or so years is P.D. Miller, who resides retired in Memphis. And his quote, probably almost 10 years old now, is that, quote, "Teeth are not lost to periodontal disease. They are lost to titanium." So on your point, Will, there's no question we've seen that. And the younger the clinician, and we've shared this before, the more teeth are generally treatment planned for extraction. So keep that in mind. Experience has a lot to do with this. So let's move on to artificial intelligence, Lorenzo, okay?
Yes, which is our third main one topics of this evening. I enjoy so far how the conversation is going, talking from leadership to regenerative medicine. And I think artificial intelligence can be overall connected, as we'll see, with regenerative medicine. So my question is that what role do you envision AI, artificial intelligence, as a game changer, playing the field of dentistry, but also dental education, personalized medicine, and how do you think it will change the focus of future dental education?
Okay. Well, yeah, we could have our whole evening session talking about this, and I know in some of the readings, Bob has selected some great background reading for us to look at. I think at so many different levels, AI is already transforming and will transform, the practice of dentistry. And I don't believe, at least in our practice lifetimes, right here, that, we will be replaced by AI and robots. But those dentists who use AI will be replacing those dentists who don't use AI, because it's going to be important, using these generative AI models from your treatment notes, going through all of your records to biomedical imaging, to bringing together curated data, as we have other technologies that can be coupled with AI on clinical decision making. And so it's a really exciting time. And Lorenzo, you remember we had the first global symposium on artificial intelligence in dentistry. That was just last November. And at that symposium, we had 25 different companies in the AI space in dentistry who were either co-sponsors of the meeting or those that were actively engaged either as speakers or attendees of the meeting. Now we're probably well over 50 plus companies in the dental AI space. And it's being recognized, actually, dentistry can be leading with the potential because there are many more dental radiographs that are taken than medical radiographs. If you think about our patients. So the amounts of data that have been assembled using, intraoral radiography has really built up the field in a great way. And so this is going to be able to, help us at many different levels. And when it comes to clinical decision-making, those involved with, periodontology of staging and grading, looking at the case severity, and then the risk factors for grading. That whole staging and grading was built to use AI models and to use the concept of patient risk stratification, where we will eventually use, this will help us in developing guidelines and protocols for patient treatment for personalized or precision medicine when we start adding on top of it other biomarkers. It could be genetic markers. Other risk factors can be built into customized risk calculators for our patients.
Well, can you share with us the next AI symposium you're holding at Harvard in the fall of 2025, I believe, right? Do we have a date?
I believe I can check. I should have had that prepared. I believe it's going to be November 14th and 15th, 2025. I can check that. It's the second weekend of November, and so we're very excited about holding this. Yeah, and I think as a part of this, because of within dentistry as well, we always like the technical hands-on approach. At our last symposium, we had hands-on workshops for AI. And so we'll have, the three same components of hands-on workshops on different AI technologies, main podium speakers, and then research forums, poster presentations for students, researchers and clinical researchers, or those who are involved in clinical practice applications.
So how can regenerative medicine contribute to personalized precision dentistry and improve our patients' treatment plans and outcomes? And also, can you describe the 4 Ps of personalized medicine described by Dr. Leroy Hood, who coined the term?
Yeah, so I think, as we look at those key components of personalized medicine in the 4 Ps, and then really understanding this distinction of personalized medicine and precision medicine. And so I think as dentists, over the years, we've really used personalized approaches for our patients, right? When you have a patient sitting in the chair, you're collecting clinical information, and you're collecting a variety of other informations on the patient's history and what are their desires in terms of what is their chief complaint, what do they want to achieve in their treatment, and so that you can customize that care for the patient in a personalized methodology. Now, the precision medicine is something that's going to be using a rubric that also includes genetic information, biomarkers, and other types of supplementary information to engage those patients. And so, having the predictive component of personalized medicine of the 4 Ps, the participation component, this is where, as clinicians, having our patients participate in the whole process of personalized medicine, this will really be, I think, one of the big game changers in promoting an approach where we can have more predictive therapies. And so I do know we had an example. Yeah, so right here, I think, Bob, this shows an example of using personalized medicine in dentistry, all right? And so I know the graphic on the left is very busy, but if you look at the far left-hand side, here's a periimplantitis lesion. You see the myriad of cell populations in that active periimplantitis lesion. And then as you see that middle part of that slide where it says immune landscape, the immune cell populations within that wound, we can find ways to measure them. And as a part of this study, led by Leo Lay and other co-workers while at the University of Michigan, he was able to then depict and identify those cell populations within the wound, the presence of immune cell profiles, and then looking at the microbiota, those pathogens that were on the implant surface. And so really bringing together using what is called patient stratification that considers that precision decision-making of how should you treat this case. And so what you see on the far right-hand side is a regenerative therapy where patients who had up to 50% bone loss around an implant, you see the baseline, surgical exposure of an implant. The procedure is not so critical, but it was implantoplasty, a bone graft, and the use of a acellular dermal matrix. The area was closed, and then patients who responded with a robust regeneration had their whole profile that was depicted on the left-hand side using machine learning to then identify those you see in the middle of that slide, high risk, intermediate, and low risk. So those patients who were good responders had a certain profile that could then be customized to say, all right, those patients who may have a better treatment outcome have this specific, that they had that specific colonization of bacteria and pathogen recolonization. So that's just an example, Bob, if that's helpful, just to show how that might be used in implant dentistry.
Thank you.
Great. And still talking about artificial intelligence, I would like to ask you, what ethical consideration should we consider as AI is becoming more integrated into healthcare, dental settings, and used by our patient daily?
Yeah, so, I think that there are so many different opportunities on the use of AI, and Bob has it in our reading, and there's one of the books you saw by Jag Singh on the use of biosensors, but there's another one by Zach Kohane, who's a professor at Harvard Medical School. It's probably the best book on healthcare AI. It's 1 year old right now, which makes it seem super out of date. But as I can call out, he's having a AI symposium on precision medicine next week that's freely accessible. And we can find a way to, give that information to people. But I think within healthcare, Lorenzo, that there's many different opportunities for the use of AI, again, on, the imaging side, clinical decision-making, and then to assist us as a co-pilot, if you will, in terms of our note generation. Lorenzo, you mentioned earlier, I didn't really get into it, but when it comes to patient education and the students using it, using AI it's going to be very beneficial. And as you know, our students at Harvard are using AI. It helps in, looking at a case, gathering the clinical evidence, examining potential treatment protocols. They bring that information to the classroom, discuss it with the faculty expert, and then maybe an output can then help them to customize their care when they get into the clinic. And then on the patient side, it's different than just using WebMD to diagnose your clinical problem, but patients can come better prepared on their own clinical questions using generative AI to better understand their situation. So as Bob asked, as part of the 4 Ps, participation, it can really engage the patients more fully.
I want to go back to the book, AI Revolution in Medicine, GPT-4 and Beyond. And the full authors are Lee, Goldberg, and Kahan, 2023. AI is the most technological advance in our lifetime. Please comment on its present usage and future usage as it incredibly shows empathy. And this is what blew me away about that book. The empathy about it, teaching physicians how to be empathetic, teaching them how to have bedside manners. It just was unbelievable. It can also teach health professionals knowledge, reason, understanding causes and effects. We'll be able to carry on full conversations with our sick mother-in-law or family member in a somewhere where we can't reach them, on a daily basis. Can translate between languages, write songs, but it has hallucinations. I know the GPT-4o, which I have on my phone, I highly recommend getting. It's only about $20 a month, but I'm telling you, I talk to it frequently. My wife is talking to it this afternoon at dinner. But could you just comment on that? Because that's one of my strong book recommendations because of you, Will. Thank you.
Yes, no, I mean, I agree with you, Bob. I was surprised to hear that as well when they do comparisons between a live clinician and the generative AI on empathy, and it only continues to improve on the AI side. So that book was spring of 2023, and now when they keep doing more and more comparisons, humans versus AI, the AI is winning consistently over the humans. And why is that? We know the machine can't be truly more empathetic than the human. But I think, as we all know, as busy clinicians, when you're sitting in the chair and you have to write a treatment note, you're so pressed for time, you're wanting to get the accurate clinical information in place. And as you're preparing that note that will be in the chart versus you're preparing a correspondence to a patient, you only have so many hours in the day. And in the book, they talk about pajama time, which is an even bigger thing with, physicians, where they're writing all their treatment notes in their bed, because they didn't have time to write them during the day. Yeah. And, oftentimes it's really using those generative AI models where they can give a much more lengthy, comprehensive response to a patient that we maybe oftentimes just don't have that time. So one of the big advances of AI is if we can get help on that back end with the patient records, that contact with the patient, we shouldn't be just looking at, okay, now we can see more patients, but we should be able to provide a more personalized and better relationship with the patient by spending more time with them than we were before when we were doing a lot of this back end work.
And a lot of the burnout in medicine is due to this reason. So this should be helpful from that standpoint. Well, I think we're at a good spot. Let's show the 7th slide, Jim, our book recommendations. I want to say I thoroughly enjoyed tonight, Lorenzo and Will, with you guys. I saw this actually, I listened to NPR, and there was a guest host who was summing up happiness. And the happiness was read a book, take a hike, reconnect with an old friend. So highly recommended. These are books that we've together have recommended to the audience. Take a screenshot. We're good with this. everything from mindfulness to AI to leadership, even mindfulness in tennis and all other sports. I mean, Malcolm Gladwell, treating people, not patients. I mean, this is all really good stuff, but Steve Jobs was the reason we put him in there, and Leonardo is an incredible leader in a different way. But Leonardo da Vinci was the total picture of his mentor from another century. So, Will and Lorenzo, can you add anything to the pictures here, to the books that are noted here, please?
So, yeah, I was just going to say, Bob, thank you for including some of my recommended books. I mean, I think this is a great list, and I highly recommend. We were just talking about today in terms of AI, future care, and AI revolution in medicine. Those are two good takeaways. And then when it comes to leadership, some of the books that I really enjoy and appreciate, The 7 Habits of Highly Effective People in terms of preparation as a leader, and How to Win Friends and Influence People. The title itself, that book, I think, was first published in around 1934. I mean, it's a classic and it's pertinent to today, but it just talks about treating people well and motivating people. And so it's one of my favorite books, but there's I haven't had a chance to read all of them that you've highlighted here.
And related to that, please allow me to just highlight one more, which is Treating People and Not Patients from Dr. Sonics, that we all know very well. I think that is a true, an amazing perspective on how we should actually refer when we have to perform our profession. And I think it's such a nice book, very, very well written, that is so pleasant to read. So that would be my recommendation, probably number one.
So, Will, I want to say thank you again, and my co-host, Lorenzo. This has been a terrific discussion, and it's very nice getting to know everybody from a personal level as well. So, and we're going to just advertise our next will be a good friend of ours, Dr. Tarnow, will be speaking, and we'll be interviewing him, probably something a little different than we did tonight. And my co-host will be Joe Can. So that'll be an interesting night. Also, good discussion clinically with Dennis, who is many of ours mentors. So I'm going to say on that note, thank you all for attending. Thank you so much, Will, for allowing us to interview you, and Lorenzo as my co-host. Thank you again. And
thank you very much.
Thank you so much, Bob. Thank you, Lorenzo.
Thank you.